We know that practices have a lot on their plate, including trying to manage patient expectations of visits running on time, of receiving adequate informed consent, of receiving their records when they request them, of you maintaining their record privacy. This is a lot to manage all these expectations. So we step in and we help alleviate a lot of those burdens, which lets you see your patients at the time they scheduled and allows you to not stress out about the stuff that's outside the realm of patient care.
We work with healthcare providers and entities of all types, small to mid-sized practices, so doctors and rehab professionals, as well as healthcare tech.
Clients come to us with established practices or new startup ideas. They either want to open a medical spa, but they're not a physician, or they're a dentist who's been practicing for years and just read in a continuing education newsletter that they are incredibly likely to get sued by nature of their profession, or they're a physical therapy practice who realizes it's time to finally get that HIPAA policy that they've read so much about but haven't yet gotten it.
The tricky thing about healthcare regulation, in my experience, is the sheer amount of regulation. There are thousands of pages for healthcare laws called statutes. For example, HIPAA alone has, I think, over 1,500 pages of regulations called in the Code of Federal Regulation and other laws.
A lot of people had more success than they anticipated, so they end up 3 years down the line, they have a thriving practice with employees, and they never got around to establishing a corporate entity, a HIPAA policy, an employee handbook, or getting the right contracts in place. So we sort of start from scratch with a lot of people, or help people get up to speed with filling in whatever gaps there are in their compliance programs.
Our clients tell us what makes us different is we're accessible. We try to answer emails and phone calls within a short period of time and understand that issues that arise in practice can be time sensitive.
We want clients to walk away feeling like we're on their team. We understand what their practice is doing, and we want to be there in the future when they have questions, and we often say we're kind of like phone a friend. People call us with random questions, and we can help them through small or large compliance or legal issues.
What I love about healthcare law is it gives us an opportunity to help people help other people. There's lots of different kinds of law. This type makes me feel good at the end of the day. It's ever changing, it's complicated, and it's really important.
What I love about our practice is that we opened it in reaction to a really dramatic and life-changing experience I had in the healthcare system. I was chronically ill for years, and it was through the assistance of and advocacy by some really wonderful providers that I made a full recovery. That was years ago, and this has been an extremely transformative and meaningful experience to me. And I love that today we get to advocate for these healthcare providers, and we get to advocate for their patients, and we get to help them better understand the patient's experience in healthcare.
Running a small business with my wife is the best experience of my life. I have found a life partner, both in life but in business, and we're able to bring our shared mission and goals together in the workplace and at home, and I find it to be extremely fulfilling, and I wouldn't trade it for anything.
That shared mission and shared goal and shared understanding of our purpose is an immensely powerful driver.